time now for the Business of Health, brought to you by Hendricks Regional Health. Well, the state has just announced a new program to help address the opioid crisis. It's a public-private technology partnership that can immediately find help for a person in crisis. Barbara Lewis has more in the Business of Health. Barb?
Gary, thank you very much. Well, this program pairs Indiana 211 and OpenBeds. It uses software to find any available treatment bed in the state. So when someone with a substance abuse program needs immediate help, there is a place to go. So joining me to talk about the new program is the Family and Social Services Administration Secretary, Dr. Jennifer Walthall. And it's always good to have you here.
Thanks so much for having me.
Okay. So this is a big announcement, so I'm not quite sure where to start, but let's talk about the beds themselves then. So what does this program, what impact will this program have on the opioid crisis in terms of residential beds?
So we've spent much of 2017 expanding the capacity for inpatient and residential services in Indiana. In fact, 26% increase just this year, bringing us to a total of about 1,008 beds that are available for individuals who have a substance use disorder issue and need treatment in that capacity. What this does is serves as really the command center to make sure that we're connecting individuals at their time of need, 24/7, 365, to those available bed services. We've never really had that global look at what our capacity is in real time. And so this solves that issue and helps us really connect individuals right when they know they're ready for treatment to the right treatment at the right time.
And that window of opportunity. So give us a little idea of how this would work. I was thinking of somebody who needs help in Rensselaer, for example, but they're looking for beds, and a bed might be available in Evansville.
Absolutely. So we designed this system really to meet the needs of what we would call our worst case scenario.
Okay.
So someone who arrives in an emergency department at 2 o'clock in the morning on a Saturday after an opiate overdose and realizes, I need to make a change. How can I do that? And asks for help. So this system is available to connect that person in the emergency department through their provider to any opening throughout the state and gets rid of the barriers of calling or faxing or places not being open and allows that connection to be made in real time without the barrier of potentially geography or insurance provider getting in the way of that person being connected. And so we're very excited about the growing network, both of referring providers and then also referred to mental health providers that can help that individual in their point in time of need. Additionally, this gives a tool to physicians, social workers, other healthcare providers who have been frustrated that they haven't been able to help the person who's sitting right in front of them to get to their need. So we're very excited about really giving them and enabling them to have a tool to really help with the opiate crisis.
Okay, so I've been asking about the beds, but this is much more than that. So give us a refresher on Indiana 211 and what all this new program will be able to provide.
So the real innovation here is not just the software, but it's the fact that it's embedded within Indiana 211, which has hundreds of referral processes to different capacities such as transportation, housing, food security, education opportunities, employment, that really take that next step and the human touch of getting into treatment and then what's next to maintain that recovery. What are the things that are going to help that individual find what they need to do next to get their life back.
Okay, you came here right from making the announcement. When will this be fully operational? When will this begin?
We are live.
Okay.
So this is open today, ready for referrals. In fact, we had a soft open earlier this week and had a successful referral. The feedback that we got was that it was the easiest thing they'd ever done.
Good.
And so we know that we have a process that's working. We have gone through several months of a pilot here in central Indiana, and we know that our referral times are drastically reduced as they use this software, and that as our network grows, those referrals that are successfully placed grow day by day.
Okay, and before we run out of time, briefly, next steps then to this?
Next steps are expanding outside of Medicaid and also outside of inpatient and residential to outpatient, regardless of insurance type and everywhere in the state.
All right, well, thank you and best wishes on this.
Thank you.